My name is Henrik Borelius, and I used to be the CEO of Attendo, which is the largest provider of care and healthcare in the Nordic countries, primarily focusing on nursing homes and home care. I think empowering the individual is it's a very important subject within social care, because I think sometimes we have a tendency working with nursing homes and home care to kind of see older people as a collective, as a group. But they are, of course, individuals who have very different interests and things they are passionate about in their lives. So I have this expression to basically let older people or try to enable older people to play the lead role in their own movie, so to speak, to be the movie star in their own movie. And I think there are many ways to do this by creating a caring and warm and empathetic environment. You basically give them support. Sometimes they are frail, sometimes they are vulnerable, but you help them so that they can enjoy activities and I think a lot of it has to do with kind of freedom of choice, that you're allowed to choose even when you're older. I think also the wording around this is very important. I've been working a lot with constantly shifting so that saying customer or client rather than calling older people patients, because that also leads your thinking and your acting in the direction of seeing nursing homes as people's own homes rather than like a hospital or an institution, which used to be the old way in care. How you define quality in social care is super important, and I think maybe there's a history in the industry of looking at regulations and compliance, and that is super important. There's a very good reason for that. You're working with people who are often vulnerable and frail, so you need to have a strong regulatory framework. But then I think the other part of it is also emphasizing customer perception. How do the nursing home customers or home care customers, how do they perceive the care? And how do they feel when we come into their homes or when we have group activities for them in a nursing home? And then the third part, which is super important, is also using best practice and evidence-based care. So looking at scientifically validated methods that we know give higher quality for people with dementia, or if you're working with learning disabilities, people with autism and things like that. And I think in all these areas, digital state-of-the-art systems and tools can help, because then they can make it's a very good way, for instance, to spread evidence-based care. You can make sure that your tools follow proven kind of processes and methods. And of course, within the regulatory part, by using digital tools, you can make sure that whether you run one nursing home or like 700 nursing homes, they are all up to the regulatory standards. I think some of the leadership principles that I found particularly useful in working in social care is to work a lot with building a strong culture, whether it's one nursing home or multiple nursing homes, it's equally important, and then having a very clear vision and mission why you are there. And it doesn't have to be the same, of course. It depends on what your DNA is as an organization and how you define it. This is like an ongoing project. You're never finished with creating a strong culture, because you have new team members joining and people sometimes forget. So there are very specific kind of ways you can work with constantly refreshing this. And then I think the other part of it is to make sure that you empower frontline staff and the local people, that you decentralize decision making, you try to create local ownership. I think that is equally relevant whether you run one nursing home, because a nursing home, typically, if you take the German market as an example, maybe they have 120 beds, something like that. So there will be multiple floors, a lot of staff members. Of course, it is even more important if you have 10, 20, 30 different nursing homes, or like I used to manage 700 nursing homes. It's even more important to make sure that people are locally empowered, that you encourage them to try things and they're allowed to fail. That's also important. So you encourage some innovation locally. They feel secure in that. And by empowering people locally, I think you're also better adapted to handling local circumstances, because this industry is still quite local in the sense that rules and procedures and standards vary a bit by local authority and maybe by region. And the more you let people decide, of course there has to be some commonality in a larger company, but the more you let people decide locally, I think the more powerful you are, and the higher quality care you deliver, and you're also able to find attract better staff, because people like working like that. I think the reason why building a learning organization is so important in care, there's like an outside perspective and an inside perspective. I think the outside perspective is maybe that this industry has been very local historically. So often great ideas and new ways of providing care have maybe been stuck in one location. And then another outside perspective is also that with the aging population in many countries, this is costing society a lot of money. So we also need to find new and innovative ways to provide care in a more cost-effective manner. Then when you look inside the organization, it starts with the culture. Having a clear vision and mission and clear values is super important. And once you start working with that and you get that in place, you have a good basis for creating a learning organization, because then people feel more encouraged and more safe to spread ideas and to pick up other ideas. And to be honest, at least in my experience, it's not that hard to get people to spread their own good ideas. The tricky thing is to get people to take on board and be positive about new ideas from someone else. Because most of us humans, we kind of like doing it. We're set in our ways. We like to do it in a certain way. And that's not just if you're a nurse or you're an auxiliary nurse, it's across all industries. So how do you get across that? Well, I think it's about encouraging risk-taking, making people feel safe, that they're allowed to try out new things and fail. It's about also, and I think it comes back to the culture, that you have a culture that is both oriented towards care, warmth, empathy, towards the customers and the clients, but also that you have a culture that is performance-oriented and a bit competitive, so that basically you can challenge your colleagues and say, hey, these guys, they are running nursing homes where they are providing higher quality dementia care, doing better activities for the older people, or maybe providing meals in a new way, a new meal concept. And you should try that out to try to encourage that. And across all of this, of course, digital tools and software is an excellent way to enable this, because you can spread ideas quicker, both with different types of kind of e-learning and training videos. But also, of course, you can make sure that the software tools and the digital tools incorporate best practice in the processes. And ultimately, it comes back to the same goal all the time: providing better care, being a more attractive employer, and doing this at a lower cost. I think technology and innovation will be extremely important for the future of social care. And I think the first thing to acknowledge is, of course, the human element is always going to be super important. I think if we think about our own grandmother in a nursing home, or our parents, or ultimately ourselves one day, we definitely want to be taken care of by a care worker. But there's so many things around the care itself that can be facilitated by digital tools. So if you look at it as a process, first of all, the whole decision and kind of assessment process on who gets access to home care and nursing homes, because that's typically a scarce resource. So how do you decide that? That can often be facilitated with digital tools. Then if you look at the whole admission process of moving into a nursing home, there are tools for that, such as CareMate, that facilitates this process using AI. Once you're in the nursing home, there's of course a whole range of documentation tasks for regulatory reasons and also for other reasons, to make sure that you follow up what is the care that is being provided to the older person and that person's health status. Where myneva Care is an excellent example, providing voice to text and also translation between multiple languages, since in many countries it's hard to find staff that speaks the local language. Often they come from other countries. Then you have the whole process once you're in the nursing home of connecting with relatives, where myneva Connect is an excellent example, for instance. So making sure that relatives, because if your mother or grandmother is in a nursing home, of course you want to make sure that you can see that she is well, and that also understand a bit what she's doing, and also share a bit in her life. And then there's a number of tools for the manager, where a tool like myneva Analytics helps a lot, because running a large nursing home is a very complex unit with maybe sometimes 100 employees and something like 80 to 100 residents. and all those things that can save time for frontline staff, and the manager enables them to spend more time actually providing care, and also making sure that it's a better place to work. I mean, spending time with the employees. And then I think the longer term, a big, maybe saying a gold mine is too strong a word, but I think there is definitely a hidden gem in nursing home and home care companies in terms of all the data around the residents, the care recipients. And there we have only scratched the surface. And there I think there's a lot of exciting stuff going on in the future that can help us. Because ultimately it's all about creating more freedom of choice, better care for the client, being a more attractive employer, and making sure that people want to join this industry and stay in this industry as nurses and auxiliary nurses. And then also being innovative and reducing cost for society and for the taxpayer.